So for this post-hoc analysis, we were really interested in seeing how patients with the high dose of aflibercept would compare with the low dose of aflibercept, and it was set up like Protocol T. So Protocol T was very exciting because this showed statistically significant improvement of visual acuity when aflibercept was compared to both ranibizumab and bevacizumab, and with great visual outcomes. And so they kind of divided patients that had 20/40 vision or better, or 20/50 or worse, and looked at those outcomes. And so that was where the process for this sub-analysis came from. So when we looked at the patients, we broke them into 20/40 or better vision, or 20/50 or worse. And for those patients that had 20/50 or worse vision, they did get greater significance of, or greater visual acuity improvement compared to those that had 20/40 or better. The patients overall in the 20/40 or better category had better visual outcomes at the end of the 1-year trial. And those that had 20/50 or vision or worse did have more improved visual acuity, but didn't reach to the same level as those that had 20/40 or better. But interestingly, when we looked at these patients, we also had them go further in between their different time intervals. And so we were looking at those patients that could go 12 weeks or 16 weeks, and many of these patients could maintain their increased dosing intervals. So those patients that were in the 20/50 or worse category, a good 90% of those were still maintaining their either 12 or 16-week dosing intervals. And those patients that were in the 20/40 or better, they were having 95, 97% of those patients keeping the increased dosing intervals, which was very exciting. Also, I found interesting that those patients that had 20/40 or better vision, their OCT findings, it wasn't quite as thick as those patients that had 20/50 or worse, which would be expected. And those patients that had 20 or 50 worse vision, when they had those OCT findings, they had increased response to the 8 milligram of aflibercept as far as the overall decrease in central retinal thickness in comparison to those that had the 20/40 or better vision. And again, likely because they just had thicker retinas, and at the end of the trial, those retinas thinned out nicely in both groups. Yeah, so when we look at 8 milligram of aflibercept, we could be confident looking at the results of this trial that whether or not patients have 20/50 vision or worse, or 20/40 or vision that's better than that, we're able to treat these patients with these extended dosing intervals, knowing that they're going to still maintain good vision and have an excellent response if they're even out at 12 or 16 weeks, compared to the 2 milligram of aflibercept at the 8-week dosing. Yeah, so for these patients, they're going to be quite happy if they're able to go quite a bit longer in between their different dosing intervals. So patients, even when I have them come back in 10 weeks as opposed to 8 weeks, they're very happy. And so if I have patients coming back at 12 weeks or 16 weeks in between their treatments, I think that patients themselves are going to be happy. And of course, that's great for us physicians, where there'll be decreased injection burdens for our clinics and everything like that as well. Yeah, certainly we have many patients that need treatment currently at every 4 or 5 weeks with some of our previous drug armamentarium, including, bevacizumab and ranibizumab. And the ability to extend patients out is both wonderful for our patients because they certainly don't need to come in as often. We're taking care of a lot of patients that have both diabetic macular edema and wet macular degeneration, and having these agents that can go longer 8 milligram of Aflibercept for so much longer is really helpful for both the patients and the clinic. Another thought is every time we do one of these injections, there's always a very small risk of an infection and an endophthalmitis in the eye. So if we can decrease the treatment burden, we're also decreasing the risk of, potential side effects for these patients as well. Well, certainly be interested in looking at, this is the 1-year data, and now we're going to have the 2-year data for the PHOTON DME. So that'll be interesting to see how these patients continue to do with these extended dosing intervals into their 2nd year. So I'm looking forward to seeing that data, as well as certainly interested in some of the subretinal gene therapy that we're talking about, and especially for some of these diseases that haven't had great treatment, be interested in seeing some of those outcomes as well. These patients that had these extended dosing intervals were always had the opportunity to have shortened time intervals. So every time they're evaluated, they want to make sure that the patients did not have a drop of 10 letters or an increase in fluid of 50 microns. And if those criteria were met, then those patients had shortened time intervals and remained in those time intervals, which is really important for the safety of the patients, because we want to make sure that they still have excellent visual outcomes with these treatments. So that's important to know. And the other thing that was interesting for me in this trial was a lot of these patients, when compared to other diabetic macular edema trials, a good 40% plus of these patients had previous treatment with anti-VEGF. So these weren't treatment naive patients. And to see these kind of responses in these patients with the extended dosing intervals, still with great visual outcomes, is very heartening, because a lot of times we'll have patients come in that have had previous treatments, and you always wonder, how are they going to respond when they're not treatment naive? And these patients were doing very well having these extended dosing intervals with high dose Aflibercept.